Thousands of doctors and medical practices billing Medicare are using fake or questionable addresses, uncovered as part of enhanced screening processes by the Federal Centers for Medicare and Medicaid Services. Here with the story is WSJ reporter Christopher Weaver, who contributed to the Wall Street Journal's Pulitzer Prize-winning investigative series, Medicare Unmasked. Chris, thanks so much for being with us.
My pleasure.
Tell us about this latest report out Tuesday by the Government Accountability Office.
Right, so this is like a congressional probe of the efforts that Medicare has been making over the last, really 5 years to make it harder to get into the program, to bill the taxpayer essentially for providing medical services. What they found is that despite some significant improvements over those years, there's still some weaknesses, and they're estimating about 24,000 providers have addresses that are essentially bogus, ranging from like UPS stores to fast food restaurants.
Oh my gosh! So is that what was the main tip-off, that these were strange locations, or were there other things?
So they use data. They use the U.S. Postal Service's own data, which flags different kinds of addresses for things like vacancies, or whether it's like a commercial mailing store, like a UPS store.
Right.
And they identified about 100,000 with various flags that raised red flags for them, right?
Right.
And then they looked closer at a small sample, just about 500. But among that sample, they were able to determine that about 100, 92 is the exact number, actually had like problems. Like they would show up at the site and there'd be nothing there,
Nothing there.
Instance.
But it looks like some of these, not all of these, are necessarily bogus, correct? I mean, even the restaurant address, which seemed so strange, turned out to be valid in the end, right?
Sure. Medicare pushed back really hard. I think they're very proud of their work in this area, and there's no question. Nobody thinks they haven't made giant improvements in recent years, because it used to be basically anybody could walk in and build a program.
Crazy, yeah.
And they're saying, like in that case, that actually the doctor was just working out of some other location, hadn't updated his data,
right?
And now they fixed it and it's fine.
And how big was the Medicare fraud last year?
So, we don't know specifically how much Medicare might have paid fraudulently to any providers caught up in this probe of the address thing, right?
The address is sort of a separate case.
Right, and it's hard to tell because not all of them even billed. But overall, Medicare itself estimates that they spent about $45 billion in fiscal 2014 on stuff they shouldn't have paid for.
Incredible. Now, is there any effort to recover some of these funds?
It's a bunch of efforts, and they get billions, but just a small fraction of the total that bleeds out of the system. They have a variety of contractors. Law enforcement prosecutes a lot of cases, more every year. But it's really just the tip of the iceberg. And
going forward, then, what kind of enhanced screening processes are underway?
Right. So they think actually that they've cleaned up a lot of the problems that the GAO identified in this report already. The report looked back at like 2013, March 2013. It's about maybe halfway through their efforts to go through and revalidate everybody in the system. Right. But they're trying to do a better job doing things like checking licenses. They say in response to the report that they'll check to see whether doctors might have lost a license other than in the state that they practice in. You got to have one of those to bill Medicare.
Sure.
But there's a lot of unanswered questions, and it's not clear whether they'll act to do things like, say, make sure doctors are actually trained to perform the services that they're providing on seniors and billing taxpayers for doing. Anybody with an MD can basically bill Medicare for anything. A
lot of work still to be done. Christopher Weaver, thank you so much for that, and congratulations again on your Pulitzer.